Welcome. We have seen that we have finished our trudge. Now we are moving to HTS eligibility. HTS eligibility will be done by HTS counselor to see if our patient is eligible for testing. Now make sure the date is okay with the time. Then let us start with the population type. This is GP, general population. Then does client have any disability? No. Then department and coverage department, we will say VCT. Patient type, we say non-hospital patient. Client a healthcare worker? No. Client has any relationship with the index client? None. HTS strategy, we have the VI, the Integrated Visit Center. Then history of HIV testing. Tested HIV before? We shall say yes. Who performed the test? HTS provider. Testing result was negative. Date tested? Maybe you can put it maybe 1 year ago. Now, we go to risk assessment. The client sexual behavior assessment. We want to see if this client indulged in activities that put her on high risk of getting HIV. Now, has the client ever had sex? Yes. Is the client sexual active? Yes. Has the client had a new sexual partner in the last 3 months? Yes. Partner HIV status. Okay. Maybe client can tell you the partner is HIV positive or HIV negative. It depends. But for our client, let us maybe use she has come because she has realized that the partner is positive. Now let us put here HIV positive. We want to make this client eligible. Okay, for your case, when you are dealing with the patient will tell you if she knows the status of the client. But for now, let us use this client. Discordant couples? No, because our patient has not came alone. So these are not couples, but she came individual. Have you engaged in unprotected sex with more than one sexual partner in the last 12 months? Yes. How many partners? Maybe the client tells you, I've engaged with 10 in sexual partners. Okay, we record. Does the client engage in sexual under influence of alcohol? Does the client take alcohol? So maybe she will tell you sometimes she takes and indulge in sexual behavior. Have you ever had unprotected sex in exchange of money or other materials? Yes. Have you recently had any incident of condom burst? Yes. Or the client can maybe decline to answer. maybe the client, she's shy, or maybe something like that, or just decline for various reasons. Have you engaged in unprotected sex with someone you don't know their HIV status in the last 12 months? Then she tells you yes. Have you had unprotected sex with someone who has non-HIV positive status? Maybe she declined to answer that one. Then we come, has the client recently experienced GBV? Yes or no? When you say yes, it will give you an option to select whether it is sexual violence, emotional, or physical violence. But for now, let us choose no. Now, we are here. Has client received any of the following recently? For PrEP, let's give it no. For PEP, for the last 3 months, let's say yes. For STI, in the last 3 months, let's say yes. The way you are answering that, you'll see that our client is at very high risk. Reason number one, the partner is now HIV positive, and you can see she also engaged in sex under influence of alcohol, then unprotected sex, has the history of money exchange or goods for sex services. Now we come here. Has the client been screened for TB? Maybe if not, or yes, you can say yes and screen the client. Cough of any duration, yes or no, it depends. When you say yes, you realize that there's something here. It checks presumptive. But when you say no, it say no signs. So we shall cover TB screening when we come back to under TB screening. But now let us finish eligibility, then we see what next. Noticeable weight loss or poor weight gain, you say no. Night sweats, no. Now, when you have your patient, you'll ask this question and the patient will give you the right choices so that you can choose from. Now, for this one, traditional or non-medical procedures, let's say no. Pregnancy assessment. Client recently pregnant? No. Breastfeeding mother? No. Now, eligibility for testing. Now, from the way the client has answered this question, is this patient eligible for testing? Yes. Now, we want to click here so that the system can generate the risk of the patient. Now you press here so that the system generates the risk. The system says that the client has medium risk and testing is recommended. You can see here. Now, testing recommended. Do you recommend HIV testing? Then you say yes. Why do you recommend testing? Client is eligible based on HIV risk category from EMR, both eligible and risk. So we select this one because the system has generated medium, but from your own view and judgment, you see that this client is eligible. Now, I can also show you something. Maybe you can get some other client, they have high risk. For example, if you take as you are, have you recently had any incident of quantum burst? Let us put yes, and let us assess the risk. The risk is still medium, but we have some other aspect that when you choose, you will see that it will bring that the client is at a very high risk. Okay, let us continue. Now, supported reasons, we have given both eligibility and risk category. Now, referring for testing. Client referred for testing, yes. Now we enter our form, make sure that you have filled all the forms. Now you enter the form. Now, you can see our completed forms. We have completed 2 forms. We have completed TRAJ and HTS eligibility screening. Now, the remaining forms are under available forms. For now, let us take a break. And when we come back, we shall see how to test, how HTS is going to carry out test and the available questions that she will be answering and taking from our patient. Thank you very much. Remember to subscribe so that you get the new content and other videos that will be out on KenyaEMR and other educational videos. Thank you. Thank you very much.